Hello, Tanse, Itlanate, Ani, bonjour. Welcome back to Our Shared Politics. My name is Nova. I am a settler on Turtle Island. I created this podcast to really showcase socialism instead of pursuing the Red Scare blindly, which just in turn pushes people further apart. I wish to express acknowledgement that I am on Treaty 8 territory, home to the Tetskane, Deneza, Nahiawak, Saulteaux, and BC Métis. It is essential I recognize all First Nations, Métis, and Inuit as guardians of these lands, both status and non-status. As a non-Indigenous person, I play a role as a treaty partner, being represented by the government. My pronouns are she, her, but I also accept they, them, and I fall under the 2S LGBTQIA plus umbrella. I say these things at the top of every episode so that you are able to make your decision on how safe of a person I am. So, dental care. A big part of healthy teeth and an overall healthy mind and body. Most of us don't think about our teeth much unless we're embarrassed by our smile or we have a toothache. But even if the majority of us don't spend any real time out of our day thinking about the 28 teeth we have, or 32 if you've never had your wisdom teeth removed, they're a huge part of our physical and mental well-being and should have been included in our universal healthcare right from the beginning. So then, why has it taken so-called Canada so long to bring in any sort of universal dental plan, and what all does this new Canadian dental care plan actually cover? Before we can actually answer those questions, we need to learn a few facts about dental care in Canada. According to the Canadian Dental Association and StatsCan, in 2019, a total of $16.4 billion was spent on dental care in Canada, with roughly 94% coming from the private sector, which accounts for 6.4% of Canada's overall healthcare expenses, and approximately 75% of Canadians saw a dental professional on an annual basis in 2018, which is actually one of the highest rates globally amongst comparable countries. The 25% who avoided going to the dentist did so specifically because of the cost. There are approximately 25,500 licensed dentists in Canada, operating out of roughly 16,000 dental offices. That works out to about 65 dentists for every 100,000 Canadians, or one dentist for about every 1,500 Canadians. Canadians with dental benefits are more likely to visit the dentist at 82% than those without at 60%, and regardless of coverage, Canadians with lower household incomes were just less likely to go to a dentist than their counterparts. And on top of that, those without insurance were about 3 times as likely as those with insurance to avoid seeing a dental professional because of the cost, 39.1% versus 13.7%. To sum it up, just over 1 in 5 Canadians avoided going to a dentist because of the cost alone. This means that they had to choose money over their health, which should not be a choice any Canadian or any human should have to make. So, why have Canadians had to make that choice up until 2024? I mean, in the Canada Health Act of 1984, it set out that the main objective of healthcare policy in Canada is to, quote, protect, promote, and restore the physical and mental well-being of residents of Canada, and to facilitate reasonable access to health service without financial or other barriers, end quote. To me, that sounds like full dental care should have been included right from the very beginning. So then, what is the Canada Health Act even, and what does it cover? In essence, it established criteria and conditions related to insured health services that provincial and territorial governments must fulfill in order to receive the full federal cash contribution under the Canada Health Transfer. With that said, under the constitutional division powers in Canadian federalism, adherence to the Canada Health Act is completely voluntary on the part of the provinces and territories, and the federal government cannot compel them to comply with the act. So basically, for what it covers, Canadian Medicare provides coverage for approximately 70% of healthcare needs, and the remaining 30% is paid through the private sector. So that 30% that's not fully covered are prescription drugs so far, eye care, medical devices, gender care, psychotherapy, physical therapy, and dentistry. Now, this is not a fully comprehensive list, as some provinces and territories do actually offer coverage for these services, and children under certain ages are eligible for different services, like children under 12 are eligible for eyes and teeth, I believe. Now, what exactly are these conditions and criteria that must be met? The 5 principal criteria are public admin, comprehensiveness, universality, portability, and accessibility, with 2 secondary conditions, recognition and information. So let's break those down, shall we? Public administration means that the health insurance plans must be administered and operated on a non-profit basis by a public authority, responsible to the provincial or territorial governments and subject to audits of their accounts and financial transactions. Comprehensiveness refers to the fact that the insurance plans must cover all insured health services provided by hospital, medical practitioners, or dentists under Section 9 of the Act. However, the only dental care that the Canada Health Act has ever covered has been surgical dental services, but only if these must be provided within a hospital. In practice, this almost never occurs. Did you also notice that it states medical practitioner and not physician? This was achieved through lobbying by other providers, including nurses, so that provinces would be allowed to define what other health professionals qualified under the Act. To date, this provision has only really been used occasionally, most notably to add midwifery as a publicly funded service. This has been done in every province and territory apart from Newfoundland and Labrador, PEI, and Yukon. Universality means all insured persons must be covered for insured health services provided by the plan on uniform terms and conditions. Next up is portability, which covers individuals across province lines. All this basically means is that when you move provinces, for the first 3 months, you'll be covered under your previous province's insurance plan before you're eligible for insurance in your new province. But no matter what, you're always insured in Canada, and the provinces will basically work it out amongst themselves. Now, the last criteria is accessibility, which stipulates that the insurance plans must provide for reasonable access to insured services by insured persons on uniform terms and conditions, unprecluded, unimpeded, either directly or indirectly by charges, user charges or extra billing, or other means, age, health status, or financial circumstances. The Canada Health Act has a provision that allows for dollar withholding of contributions from any province allowing user charges or extra billing to insured persons for insured health services. Okay, so those were the 5 criteria. What are the 2 conditions then exactly? Recognition, meaning the federal government wants credit for their half of the contributions. Quote, the provinces shall give recognition to the Canada Health Transfer in any public documents or in any advertising or promotional material relating to insured health services and extended health care services in the province, end quote. And lastly, information. The provinces must provide info on the operation of their health systems to the federal government. So all in all, as long as the provinces and territories fulfill these 7 criterion conditions, the government will uphold their half of the deal and pay 50% of all covered healthcare services. So far, all non-compliance issues have been able to be settled through discussion or negotiation, and the federal government has actually not had to withhold any funds as of March 2024 from any province or territory. Now that we have a pretty good basic understanding of the Canada Health Act, we can focus on dentistry and the new Canadian Dental Care Plan. The Canadian Dental Care Plan opened in December of 2023, and applications are now open to those who qualify. To qualify, you must have no access to dental insurance, an adjusted family net income of less than $90,000, be a Canadian resident for tax purposes, and have filed your tax return in the previous year. Canadian residents who have access to dental benefits through a social program offered by their province or territory and/or by the federal government will be eligible for the CDCP if they meet all other eligibility criteria. So, when are the applications open? Well, the applications began being accepted for seniors aged 87 and above in December of 2023. Seniors aged 77 to 86 years old were able to apply in January, and seniors aged 72 to 76 were eligible starting February. This month, March 2024, seniors aged 70 to 71 are able to apply, and seniors aged 65 to 69 years old will have to wait until May 2024 to send in their applications. And then persons with a valid disability tax credit certificate and children under 18 years old are eligible starting in June this year. All remaining Canadians are expected to be able to apply beginning in 2025. Thank you, NDP. To make this a bit easier for seniors, letters were mailed to eligible individuals who were 70 years old or would be by March 31st, 2024, and had the adjusted family net income less than $90,000. These letter holders were then able to call Service Canada and apply over the phone with an immediate notification of successful application and acceptance, as well as receiving a letter confirming this. For everyone else, an online application portal will be open in May 2024, and it seems as though you will be expected to apply there. Once you're determined to be eligible, Service Canada will then share your info with Sun Life, the contracted service provider. Sun Life will then send a welcome package, coverage details, their member card, and the start date of coverage, which will begin as early as May 2024. Now, I'm not going to speak through an alarmist megaphone here, but I think it's important to note that Sun Life has gone through many controversies in recent years. On top of that, Sun Life's largest shareholders include all of the major banks and Vanguard Group. If you're on the leftist side of the internet, which I'm assuming you are since you found me, you've probably heard of Vanguard, and you probably know they're neck and neck with BlackRock in terms of asset management companies. So anyways, enough of the conspiracies, back to real hard facts about Sun Life. So in 2018, Toronto Star Investigations released an article entitled Sun Life Deceitfully Concealed Sales Misrepresentations About Life Insurance Policies, Customers Allege. So to summarize, sometime prior to this article, Sun Life took over administration of MetLife's policies and found that MetLife agents had misrepresented Canadian consumers on how the cost of their insurance could rise over the life of their policy. Sun Life wanted MetLife to be on the hook for any legal claims by consumers who said they were paying more than they'd been promised. However, while this was all going on, Sun Life continued to administer these exact plans, unadulterated, charging increasing premiums to hundreds of thousands of Canadians while deceitfully concealing its knowledge that systematic sales misrepresentations had occurred. Then, in February 2020, a $10 million class action lawsuit was filed against Sun Life, claiming that Sun Life incorrectly calculated the cost of living increase to which all class members were entitled on an annual basis, and it also alleged that Sun Life knew that the manner in which it was calculating the cost of living increase due and owing to the class members was contrary to the terms of the policy and that it willfully misled the class members in doing so. I just want to reiterate that I'm not trying to scare anyone away from Sun Life in general or from accessing the Canadian Dental Care Plan, but I think it's something you should be aware of. However, it probably comes as no real surprise that a multi-billion-dollar health insurance company of all things is shady. So, what exactly is covered under this Canadian Dental Care Plan? Well, straight from Canada.ca, it says, to improve oral health outcomes, the CDCP will help cover the cost of various oral health care services on the recommendations of an oral health care provider when needed. Services that could be covered under the CDCP include the following, with some services only becoming available in fall 2024, and they don't specify which. So here's the list. Preventive services, including scaling or cleaning, polishing, sealants, and fluoride, diagnostic services, including examinations and x-rays, restorative services, including fillings, endodontic services, including root canal treatments, prosthodontic services, including complete and partial removable dentures, periodontal services, including deep scaling, and oral surgery services, including extractions. So basically, one of the only things that's not included on here is braces and teeth whitening. Basically, the only services not covered will be teeth whitening, implants, and mouth guards and braces. That's a pretty comprehensive plan that could impact nearly 9 million Canadians. But unfortunately, it's not quite comprehensive enough. Outside of those 9 million Canadians who will qualify, there are another 4.4 million Canadians who don't have dental benefits through their employer, yet they make over the income cap. To include these individuals, the government would have had to budget an additional $1.45 billion on top of the $3.3 billion already budgeted for the first year. However, it's not as though $90,000 is really all that much for a family with 2 children and 2 parents, which is what the adjusted family net income is based on, as each parent would only be making $45,000 salary in Canada, yet making more than that precludes those families from receiving this federal dental care coverage. I personally think that this is just a step forward, and by the end of the 5-year budget, we will hopefully see a true universal dental care plan being formulated and being included into our universal health care for everyone. Because could you imagine if they told everyone that who made over $90,000 a year in Canada that they had to figure out their own health insurance as well because they made too much money? I think that would cause an absolute uproar. If you're all for that, I mean, I hear America is still accepting Canadian immigrants, at least for now. Dental care is health care. Dental care can be a life or death situation, which is why I am so strong about this. A 31-year-old man in Ottawa almost died in 2016 from a dental infection. What should have been a simple trip to the local dentist turned to sepsis, which spread to his bloodstream. He ended up in the ICU and needed a leg amputated below the knee, as well as several fingers and toes from the other leg. He spent the next year rehabilitating in a long-term care home. Now that's terrifying, and on top of that, as much as I hate to mention it because he already paid an unthinkable price, consider the added monetary cost to Ontario's healthcare system that should not have had to happen in the first place had that man been able to get dental care in a timely, inexpensive manner. Thankfully, not all delays have such dramatic outcomes, but tooth loss leads to depression, poor oral health impacts self-esteem, social interactions, and employability. Treating gum disease in diabetics improves blood sugar control, and providing oral care in long-term care patients reduces the risk of aspiration pneumonia. Basically, it helps everyone, and there's no reason dental care should not be included. So exactly how much will be covered under this CDCP? Well, first things first, to limit out-of-pocket expense entirely, oral health providers who enroll as service providers in the CDCP and provide oral health care services will bill the CDCP directly for reimbursement rather than patients having to seek any reimbursement from Sun Life. There will be co-payment tiers, so don't start freaking out about your taxes paying for poor people just yet. The percentages of co-payments will depend on the adjusted family net income as follows. No copayment for those under $70,000, a 40% copayment for those between $70,000, $999,000, and a 60% copayment for those between $80,000 and $999,000. More than 400,000 Canadian seniors, which I think on February 8th during question period, they actually said it's actually now over 500,000 Canadian seniors have been approved already as of February 8th, 2024. And that was only seniors aged like 70 and up. That's absolutely wild, and I'm so glad we're finally able to take care of our senior Canadians properly the way we should have been able to this entire time. The budget for 2023 also announced an investment of $13 billion over 5 years, with $4.4 billion ongoing to implement the CDCP, making it the biggest government program in generations. This is an investment into a healthy future for Canadians from coast to coast to coast. Now, this is not the end of the fight for universal single-payer dental care in Canada. This is only the beginning. I'd like to include here an excerpt from a Policy Options article from 2022. Quote, "We must not forget that doctors were the biggest opponents of Medicare, going on strike for 23 days when Medicare was first introduced in Saskatchewan. Now, very few physicians in Canada could imagine working in a system where access was dependent on the ability to pay, especially after seeing the pandemic disproportionately affect already marginalized communities. Tommy Douglas worked tirelessly to prevent Medicare from being watered down, and the federal government is starting with an already diluted dental care commitment. It must concentrate, show courage, and ensure that its plan brings dental care out of the 19th century and into the 21st, stepping toward a truly universal single-payer system." End quote. So basically, to sum it up, oral care is health care. No one should have to choose between taking care of their teeth and paying their bills. The Canadian Dental Care Plan is going to make it more affordable for every Canadian, especially those of low income, to access dental care. And this can be life-saving dental care, or at least life-impacting dental care. So, as always, thank you for joining me today. I drop a new episode every Monday morning at midnight, so check back in next week to see what I'll be sharing with you then. So-called Canada is in a fentanyl and mental health care crisis right now. Please consider picking up a free naloxone kit at your local pharmacy, and do not use alone. For any Indigenous listeners out there, the Hope for Wellness Helpline offers immediate culturally aware and trauma-informed help to all Indigenous people across Canada. It is available 24 hours a day, 7 days a week in English and French to offer immediate support and crisis intervention. While there are supports in Cree, Ojibwe, and Inuktitut, those are not available 24/7, so you may need to call in to find out the next time that a language speaker will be available. Call the toll-free helpline at 1-855-242-3310, or you can connect to the online chat at www.hopeforwellness.ca. And there is also the Thunderbird Wellness app that provides access to Indigenous perspectives on health and wellness, including substance abuse and mental health. Now, not that Indigenous people can't use these next resources, but they do not advertise as culturally aware or trauma-informed, so for everyone else, if you must use alone, please keep in mind that you can call 1-888-688-6677 to contact the National Overdose Response Services to access support while using and especially using alone. And there is the Brave, BRAVE app with a use alone timer that connects a paramedic with your location if you don't respond. For mental health support, you can always contact 988 to get connected to a crisis responder. If you learned something new today, it'd be awesome if you'd click that button and follow along for next time. Or if you'd like to contact me with feedback, you can email me at oursharedpodcast@gmail.com. Time to scoot, little new.